just because I want to balance out, obviously waiting for everyone and knowing Andrew especially is sort of time limited. So if we're all okay, we'll get cracking. I mean, the first bit's just a little bit about us for those of you who don't know who we are. So as Fran said, for anyone who's just joined, we are recording this. So if you don't wish to be on the recording, if you wouldn't mind just switching your camera off, that will be wonderful. So what I'm going to do is I'm going to quickly share my screen and pop up a quick presentation. So if someone could just let me know, not that one, if you can, everything's in the way of me pressing the button that I need. So you should all see a very bright pink SARD sign. Does everyone see that yet? Brilliant. Well, before I kick off, I'll introduce myself. I won't introduce everyone else because it would take too long, but good morning, everyone. I'm Phil Bottle. I'm one of the co-founders and Director of Sales at SARD. And I've been around since the very beginning, which is 10 years ago now. So just to ensure everyone understands what we're here to talk about. So the purpose of today's webinar is to go through our all staff job planning module. We obviously have other job planning modules for medics, but we won't be going through that today. So this will focus on that. At the end of this session, if you do have any interest, if you don't already use any of our systems in finding out information about the rest, then please feel free to come to us directly. I know that Chris will be following up with everyone that comes in today. So just a little bit about us for those of you who don't know who we are. So we've been around for 10 years. We were born out of the NHS. Specifically, we worked in partnership with Oxy's NHS Foundation Trust, which is where I came from. So I was head of learning and development there. And then Kevin and I, who's also on this call, got together, started to build some systems for Oxley's. One thing led to another, and a company was born. And as I say, that was 10 years ago now. Since inception, which really started around medical revalidation, and we then built 360 job planning for medics, e-leave, and as you can see now, we have a sort of a full suite of systems. And most recently, we developed the job planning for all system. So we do cover a lot of workforce sort of system requirements within the NHS, but as I say, today specifically, we'll just look at job planning for all. Over the last 10 years, we picked up a number of clients, some of which you'll see on here, cutting across acute mental health and community. And we're happy, of course, to discuss individually with anyone if you want to know any more information about that. One of the most important things, and actually it does link into this, because I'm going to talk in a minute about why we've got job planning for all, why we've built this, is around NHS E&I, who have talked a lot about interoperability and levels of attainment and how we can best utilize systems for our workforce planning and to sort of prioritize our resources within the NHS. One of the key things for us is to ensure that when we develop a new system, that it has a level of interoperability, because what you don't want is silos of data that sit around that are not really usable or effective in terms of planning and making strategic management decisions about where your workforce is best utilized. So as you can see from this, what may seem like quite a complicated diagram, it's well thought through in terms of how we operate and how we bring these systems together, whether they be sort of using our full suite of systems or whether it's sort of just individual systems that you wish to link to other areas. So we're very keen on making sure that whatever systems we have, that we can talk to other systems, because that's really the point of ensuring that workforce is utilised properly, is that you have multiple different areas, whether it be about rostering staff or it be about job planning, appraisals, leave entitlement, so on, that these systems should talk to each other. So that's a little bit about us. As I say, the purpose of this is really around the job planning element, and more specifically around these levels of attainment, which, as you can see in front of you, is our sort of cut down version of what these level of attainments are. But really, since about 2003, there's been a clear sort of pathway set out to ensure that job planning for all clinical staff is in place within sort of every NHS trust. And they really wanted to make the case for this to ensure that job planning played a more pivotal role, as it were, in terms of allocation of resource throughout the trusts. So as you can see here, most trusts, when this was released, found themselves at varying stages, and most trusts, if they had any form of system, would have been around medics. But there's been more of a push around sort of allied health professionals, clinical nurse staff, and various other health-related clinical groups that require job planning. So that's the approach that we took. We utilised all of the information that we had from our medical job planning system, which has been in place now for about 8 years and used across various different trusts. And we recognised that within each trust and within each of these different clinical groups, there would be differing requirements. So we took what we already knew, and we took the sort of experience that we had in terms of developing medical job planning, and we created something, and we designed something specifically for non-medical staff groups, as you can see here. So it does cover, as I mentioned, allied health professionals and clinical nurse specialists and other staff operating across sort of nursing and clinical settings. So what I'll do now is I will pop across to the actual site itself so we can get into some information and show you what we do. So my plan here is to really take you through from an end user point of view, and then we'll move on into sort of the admin side of things. So how you get individuals to use the system, what sort of data they're required, how the system works, but then as an organisation for the governance side of things, how you can pull that information out and utilise it. So I've logged into our demo site, and on here, the first thing we'll see is a dashboard page. Now, you'll notice at the top there's a couple of different areas around job planning, appraisal and MSF. So everything we deliver is on a modular basis. So you don't need to use all of our modules to use our system. You can take specific modules. So you could just use job planning for all as a standalone system. But it gives you an idea on here that if you do wish to add to the suite, that there's opportunities to do so. And it all sits in one place. So it's very easy to access as you go through. We always ensure there's a dashboard. So whenever an individual user logged in, there's information that's pertinent to what it is they're actually doing. So within this, we've got information about sort of previous job plans that someone will have done. There are other areas that I just want to quickly point out before I move into the job planning for all system, because it's really important to us. So we work on a partnership basis with trusts, and we rely very heavily on ensuring that we have the support in place for every individual user. So we currently have around 50,000 users across all of our modules on our systems, and every single one of those end users has access to our support team, and that's something that's really important to us. And as we go through, we'll be able to sort of touch on that a bit more. So just so you're aware, there's sort of video tutorials, there's static help and feedback. There's actually an online live chat system, which is really popular. And that allows every user, if they're unsure about what they need to do, they can contact us directly, and we have a support team in place. They're not a third-party support team. They are all internal within SARD, some of whom may already be on this call. We also try to ensure that we cover different bases as well. So accessibility to the system is really important. We want to compete on simple, but we want to make sure that everyone has access and they can engage. So just things like making sure that that it's not just color coded, that there's symbols in place, so individuals can understand where they're at within the process. Equally, we have user guides and supporting documentation. So if there's anything sort of particular to trust, or any policies or procedures that you have around this particular area, they can be added to the dashboard. So it really allows you to sort of bespoke how people go through the system. But as I say, user guides as well. So support is really important to us, and it's something that we've had in place for the full 10 years that we've been running, and it just gets stronger and stronger. We get overwhelmingly positive feedback from this. So job planning for all itself. So one of the things, if any of you on the call already use our medical job planning, you will instantly notice the difference between what I'm showing you here today and what you may well be used to seeing elsewhere. If you've never seen our medical job planning, then this is a good starting point. So when we designed this, we wanted to ensure that it was as simple as physically possible. We didn't want a system that was onerous, that would sort of ensure that engagement was low because it was too complicated. There was too many moving parts. So we've tried to keep things as simple as we possibly can. That doesn't, however, mean that we can't add to or develop around the system. That's something that we have vast experience in. And for those that already work with us will know that. For those that don't, feel free to ask colleagues that do. So it's important to us to start from a basis where we can keep things as simple as possible. One of the things you'll notice is that I'll be on one tab as we go through this demonstration. So I'm not clicking around in various different places. I don't have to open 100 things in order to be able to complete the task. And you'll also notice that within that one tab, I'll be on one page the entire time. So we like to ensure that we minimize clicks, make things very straightforward and easy to use. So the structure of this site, the first thing that becomes obvious is really who the person is and when the job plan effective date is and when it will end. The next most obvious thing on here is the activity summary. So within this, it always keeps tab on what activities and in which categories are being added to the job plan. So as you can see here,
so Phil, just to butt in just briefly, Susanna, can you said you can't see the system on the screen. Is it okay now? Or?
Looks like she's left. She's probably coming back in.
Okay.
Can everyone else see it?
Yeah, I can.
Right. Okay.
Yeah.
Cool. So I can't see anyone or anything other than my screen. So yeah, please just shout if there's something.
That's right. I just thought you might not have spotted it. But...
Yeah, no, I didn't. I didn't.
Carry
on. So cool. So yeah, just in terms of this, so we have our sort of activity summary, and as you'll notice here, we deal in hours as opposed to in the medical side where we deal with program activities, so PAs. This again is because that requirement is very specific to medics and not so much for any of the other clinical groups. So we deal in hours here, and we deal in the idea of how the time is split up over a job plan. And it gives you a total number of hours that currently exist when you've developed a job plan. So I've actually reopened this job plan. This was one that was completed, just so I can show you how we can add different areas. So within here, we've also got the opportunity to download all the information as a PDF. That's quite important because people like to have either hard copies or to be able to take information away with them. Share as template, I'll get into that in a bit more detail when we get to the admin side. Suffice to say that you can create templates around certain groups of staff, share those, and then they can use that as a base point in order to create their job plan. It may be that they only need to tweak certain areas. And then you'll see there's four main sections that we'll go through. So the first section is just the general information. Some of this is just information led. It doesn't actually have any impact on the system. Some of it is for reporting purposes, and some of it actually has a direct impact. For example, when your start date will relate to when you next need to do a job plan, the number of working weeks that you've got, and your number of contracted hours. So the first sort of four sections are really for information and reporting purposes. So we break this information down. So when we get into the admin side of things and reports, it allows us to break that information down to be very specific about what you want to be able to see. The employee number is obviously a unique identifier. So it's something that each individual will have. And then we have the UK Public Health Register number as well that we can pop in there. The banding, although this is a very high banding, it's only a demo site, so we just put sort of random information in. You'll notice on every section as well, there's the opportunity to leave comments, and that's just useful for individuals that are going through the system if they wish to add some comments as they go along. It doesn't have any material impact on the job plan itself, but nonetheless, it is there for you to use. So this is also useful because ESR is not always up to date. So it's also useful for an individual to be able to say, actually, some of this is not right, and I need to be moved. This is the area that I work in. that gives you the opportunity to make sure that information is useful and accurate. The next section that we go through to on here is the idea of signatories. Now, in here, we've currently got the opportunity for this to be signed off by the individual themselves and their line manager. Again, to keep it very simple, in our medical job planning, you can have multiple signatories. So if that's something that is an absolute red line for a trust to say we need more than one, then we can essentially transfer that functionality across. But as it stands, it gives you the job plan owner and the line manager with their contact details as well. Probably the most important part, however, of the job planning for all system is this timetabling. So what you'll see here is we've already set this one up. So you can see the activity summary, and then this is really a further breakdown of that to give more information, but also the area where we can start to add new activities as we go through. The first thing that I'll start by showing you, though, is how we can actually view the timetable itself. So we've got a breakdown of activities by day. So this will say this isn't every single Monday. This is just to say these are the things I do on Mondays typically. So you can see there's things like direct clinical care, there's supporting professional activity, there's additional responsibilities as we go through the day. And it gives you an indication as to what the category is, what the session is, where it takes place, how long it lasts, and how often it runs for. So you can get start and end times, and then it will pick out the average time per week. And that's what starts to build up this number here along the way. So we can see for every single day, but if we go to the bottom, we can also see that we've got a flexible section as well. Sometimes administration work is not always defined on a particular day or scheduled at a particular time, but you still know that the individual's got to do it. So they may work in a couple of hours or 1 hour or 15 minutes, as you can see here, planned into their week without a specific time attached to it. So that's one way of looking at the information in here. I can also look at the activities by category. So I can see everything that I do, which is direct clinical care, when I do it, how often, and so on. Anything that I do that's supporting professional activities and anything that's additional responsibilities. We also have a weekly overview. Now, this isn't quite the same as the calendar because this shows you, again, everything that you would do on a Monday. It doesn't mean that you will do this next Monday. It just means that in terms of your job plan, these are the different sessions that you would expect to do typically on a Monday. If I was to then go to the calendar, this will actually show you what sessions within your job plan you are due to do on a particular day. So you'll notice as I go down on Friday the 2nd, I have 3 entries. I have 3 entries on Friday the 9th as well, but they're different. So instead of a multidisciplinary clinic on Friday the 2nd, I've got a service development meeting. So this will actually give you sort of real time, as it were, what you've said you're going to do on particular days. So that's the overview of how we can see this activity. In terms of adding it, if I wanted to add something new, I'd simply click on new activity. And then I have the options. So we've got a number of categories. These purely here for example purposes. If there's or categories that you wish to add or they slightly differ, then that's easy to do. And I'll show you how to do that in the admin section. So I'd select the category. I'd select the activity. So it may be that this is a ward session for direct clinical care, and I can select the location. And again, these would reflect the locations that represent what the trust requires. So we'll just put in hospital in here. I can add a description if I wish to. Oh, there you go. Got Grammarly coming up. Don't really want a quick tour of that. Whether it's on call or not, there is the within the medical job planning. There's obviously a big focus on sort of on-call work. It may be that you don't do any on-call work, but if you do, you have the opportunity to say that it's on-call. Then we move down to whether or not, as mentioned before, this is something that you can schedule. So if it's direct clinical care, it's likely that it will be scheduled. If it's something around administration work, you're doing something on your appraisal, you've got to write up some information, then it may very well be flexible. It doesn't have to be. You can still schedule that time in. So when I go to schedule, I have some opportunities to say how long I think it will last. So at the moment, as standard, it picks 8 till 12 in the morning. It doesn't have to be, you can pick any time. It could be 1 to 2, it could be 1 to 2:15. It doesn't matter. We then have the opportunity to say how often this repeats. Now in here, we only do weekly or monthly repetitions. That's because when we were developing this in sort of partnership with other trusts, they were really the main sort of repetition frequencies that were coming across. There were very minimal numbers that sort of fell outside of that. But those that are familiar with medical job planning will know that we can do sort of never repeating or daily as well. So again, if that's a red line, if that's something that is required within this system, it's very easy for us to transpose it across. We just didn't want to add too much detail. As I say, we wanted to keep this simple. So we could say that this repeats weekly, and we could say that it's over sort of a 3-week cycle that this happens. So on weeks 1 and 3 on a Thursday between 8 and 12, this direct clinical care ward session will take place. Now, I won't add it. The reason I won't add it is because I've nicely got the timing almost perfect on this to 39 hours and 59 minutes, which if I go back to general information, you'll see I'm contracted 40 hours a week. But that's how I would add something if I wanted to. It doesn't have to be direct clinical care. As I say, it could be any category. And then the final stage really of here is the sign-off process. And again, it's all online. So one of the things I didn't mention is this is all cloud-based. So you can access it from any device. As long as you've got internet connection, it's optimized for mobile phone, tablet, and obviously laptop and desktop. But everything will take place online with this. So in terms of sign off, I actually did sign this off and then I reopened it. So you do have the opportunity to reopen or return to draft if something material changes. Obviously, if you've completed or come into the end of a job plan, you just start your next one. But on here, I can sign it online, and I can also send reminders to my line manager to say that this needs to be signed. So if you reopen something, it will need to be signed off by both parties. Again, you can't just unilaterally change something. So that's a whistle-stop tour of the system itself. What I'd like to do now is just take us back to the administration side. So I'm actually impersonating someone on this system. So I'll go back and we'll look at the admin side. If there are any questions at the end, just feel free and I can take us back into the system itself. So the things I just wanted to cover briefly in here, again, you can ignore the modules that we're not focusing on today, but within job plan, one of the things we try to do is to have a very comprehensive reporting functionality within the system to ensure that you can report as an organisation, break information down, as you can see, by directorates, locations, teams, specialities, etc. The first thing I wanted to touch on here, though, is the idea of job plan templates. Because we've been talking about how individuals input information into the job planning for all system, I just wanted to show you that there's easy ways for you to do this, not in bulk, but in terms of if you have a group or a particular clinical group that have very similar job plans, that actually to save some time and to make sure that you're working together, you can create these templates. And what you'll see here is I've just this morning created one for allied health professionals. And essentially what it will allow me to do is to give sort of a number of working weeks, but then I can go in and start adding timetabled activities exactly the same way that I just showed you for the individual. So I can suggest whether it's direct clinical care, whether it's hospital, it's not on call, it's scheduled, it happens. Let's say it's on we know we do sort of a 4-week working pattern every Monday, weeks 1 and 3 between those hours. And I'll say that, and then it will start to put that information in, and you'll start to see it on the calendar. It's weeks 1 and 3 as we go through. And once all of that's completed, that can be utilized as a template for other users. So if I go back in here, excuse me, there you go. So that's useful because it helps you to be able to share this information quickly and easy. It may be that it is an individual job plan and you can't utilize a template, but if the situation arises, then it's there to help. The other thing I just wanted to touch on quickly here is I mentioned the fact that you can add sort of categorizations, and this is how easy it is to do. So you'll be able to go in and add a new DCC activity. It may be that you wish to change different default options on here. All of that is completely doable. It may be that you utilize your own language within the trust at certain things and people will recognize different areas. And again, that's easy for us to do. Likewise, activity location. Now, the reason why I'm showing this is because one of the things we like to ensure with all of our modules is that the administrators within the trust have sort of the capability to ensure the system works for them, and you're not overly reliant on asking us every time you need to do something. So we will give you the training that you require as administrators to be able to do these things, to be able to add locations if things change, but we're very happy to help the entire way through. So you have sort of the ability to be autonomous with the system, but without us ever sort of abandoning you. We're always there to help. So that gives you an idea of almost like the sort of setup, the things that sit behind the system. In terms of the reporting side of things, so the first thing we've got is all job plans. So I can literally see quickly, these are all the job plans that exist within the system, and it's over 3 pages. And I've got a quick view of when someone last completed a job plan, if they haven't, what their current job planning date is. If I want to actually have a look in terms of compliance reports, so it's easier to see, then I can have a look at a compliance report across the entire organization. So I can see here that 88.2% are compliant, whereas 11.8%, 6 are not compliant. That was much better this morning, but as I say, I actually turned Jose from compliant to not compliant. So you'll also notice under here that we have filters. So I can see here, I just want to have a look at the non-compliant people. And as soon as I do that, what it would do is it would just return me all of those non-compliant individuals here. Now I can go in individually and look at them. So I can go in and have a look at Jose, and it will tell me the information about who they are, where they are, and their particular job plan. And again, I can go into more detail within that. But equally, I can then email that group. So I can say, hey, everyone, you're non-compliant. You need to get this completed, and I'll be able to sort of have some basic information in here about where they're at and that particular situation. I may, however, wish to start looking at this information in more detail. So again, in here, ignore the sort of directorates. These are just here as examples. But I can quickly see out of these 3 directorates that in children's medicines, there's 18 users, 100% job planning compliance. Is actually the imaging service here where there's 20 that has the lowest compliance. Again, I can click on that and it will just show me the compliance for that particular area. And again, it's quick to see who's non-compliant and who is compliant. Like with the other report, I can then go in and filter that down. We also have sort of like a third stage in here, which is compliant with upcoming renewal. Just so happens within our demo site, everyone is compliant in terms of quite a future date. So there is no one that falls into that category, but if they did, I'll just be able to filter them down. I won't go through every single one of these, but they're relatively obvious in terms of this breaks down the information. So I could break it down by location. Within that, I don't know if there's any locations on there. No, there isn't. There you go. Let's go to Teams. I don't think we've added any of these in at the moment, so that's very useful. There you go. There's one. So we've got by speciality. So you can see that it's broken down here. And again, I can go into each of these different groups if I want to just pick one at random. It works in exactly the same way. So I can drill down the information from top level organization, by directorate, by teams, by speciality. And within each of those, I can then go in and look at more detail about the individual themselves. If that isn't enough, we also have something called the Advanced Job Planning Report. And this is something that actually Kevin, who's on the call, developed some time ago. So well done, Kevin. And this is for those people that wish to be able to break down information in real time to really specific levels. So what you'll see in here is when I open it up, it shows me quite simply who has job plans and who does not have job plans. And it shows me the percentage. If I was to click on one of these, it will then show me the individuals that fall into that category. So it shows me who's got job plans, and it shows me the breakdown of how those hours are split up between DCCs, SPAs, and ARs on here. I can, within this, go in and change different things. So I can just specifically look at DCCs, and it will show me within the current people that have got job plan again, who has DCCs and who doesn't. These people don't have job plans, so they don't have any. If I wish to have a look at schedule versus flexible, this will show me at the moment 100% of all DCCs are scheduled. However, if I was to change that to all categories, it will then show me that out of the scheduled, these are the number of DCC, so direct clinical care time, the number of supporting professional activities, but it also allows me to see what the percentage of flexible hours are. So I can start to build a picture in terms of how much time is actually scheduled and how much time is almost sort of floating time required to complete different tasks. So you have the ability to continue to break this information down as you go along. Again, I won't go into all of these because I want to make sure there's some time for some questions at the end. You'll notice here that we can actually change the units, because if you're obviously utilising job plans both for medics and for non-medical staff, it does give you the opportunity to see things in different ways as you go through. So I can look at this particular scope. This is across the entire organisation, or I can start breaking it down. So I can have a look at what this split looks like just within children's medicine. And within that, I can look at particular speciality as well. So there's lots of opportunity within this to break this data down and ensure that I can see real time what's happening. And as I mentioned right at the very beginning when we talked about the levels of attainment, this is about how do you utilize your workforce. And the best way in order to be able to utilize your workforce properly is to have really solid information about what people plan to do within their jobs over the course of a year. So there are other options within this, just while I'm on here, in terms of we can break this down even further in terms of team, location, position, title. You can see here that this is just for non-medical job planning, as it's termed in the background here. You can look at it against medical groups as well if they're included, if you've got a module. And then you can start to break it down even further. So it may be that I only want to look at people that are in a current draft state or completed over a particular time period. And all of the information within here is exportable. So you can export any of these reports out into a CSV file for further interrogation. You'll also notice here that we can actually export all job planning activities. So the last thing, just briefly to show you on here before questions, before I go back to the presentation, is the fact that you have sort of full control over your users as well. That's important. We operate the idea of a 10% tolerance, so we work on a per head, per license basis. So if you were to purchase, say, 100 licenses, you get a 10% tolerance, which essentially means that as users of the system, you can add, you don't need to ask us to add every time you get a new user. You can just do that. And you won't be charged on an individual invoice basis if you go over that number until you sort of break the 10% barrier. So if you had 1,000 licenses, you get 1,100 licenses before we even discussed sort of re-invoicing. But within here, I'm able to go in and see the individuals, that information, and it's very useful breakdown. So it tells me how often they've logged in, when they last signed in, their sign-in count, when they started with the trust. So any information I may require. I just briefly wanted to touch on that because I know it's about job planning for all, but actually, if there's any administrators in here, being able to sort of properly administer the user side of the system is also very important. There's lots of different options as well within here. Some of them don't relate to this, they relate to appraisal recommendations, etc. But there is the opportunity to look in more detail as we go through. So again, that's a whistle-stop tour of the system. I know we've not got a huge amount of time. So what I wanted to just to briefly do is go back to my presentation just to cover off a couple of other points. So obviously, we're very happy to go into more detail if anyone is interested in looking at purchasing the system, or you want to know more information about that. We're more than happy to come back individually. So if you just contact us about that, that would be great. It is very straightforward, though. We've just recently got onto the HSSF framework, which is specifically around job planning and rostering. So we've been admitted to that. So it's very straightforward to if this is a system that is of interest, to actually go through the procurement process with that. But I really wanted to end on something around how we work and what impact that's had. So as I mentioned before, it's a lot about partnership working. So we like to develop all of our systems in line with our clients to make sure that they're meaningful, that they're useful, that we cut out any of the things that we don't require in the system so they're effective. They've got to be easy to use for the end user, intuitive, simple, but they've also got to have the capacity to be able to present you with really relevant information and the back end, so for administrators. So we have to balance that right, not making it onerous for the end users, but making it comprehensive for those that utilize the governance side of things. And just to really end on a couple of testimonials that we've got. So I won't read them all out, you can see for yourself. But this is what we feel we add to the marketplace with really good partnership working and a really strong idea of support. These are the types of things that people will say about us and how we work and how we operate. So without further ado, I will stop talking, which is unusual for me. And I am happy to take any questions that you may have. So please just shout, because I can't see it.
That's really good. It's a really good overview. Thank you very much.
No
I think there's a few questions just in the chat on the right hand side.
Right.
I think the first one is from Imran. It says, how does it cope with split roles or jobs? So
right, sorry, yeah, Imran, yes, hi Imran. We've spoken before. In terms of splitting roles, so if you covered sort of two different roles within your sort of contracted weekly hours, is that what you're asking, Imran?
Oh, good morning, Phil. Hello. Yes,
Hi,
thank you for the presentation. I really enjoyed it. Yes, that's what I'm trying to. So to give you an example, I could have a medical consultant. So I'm from mental health. So part of this person's hours will be spent in, say, a rehab unit, and then the other hours could be spent in a recovery team. So effectively, you've got two separate roles or jobs going on there within our services. And I know within our ESR, they don't like to give two payslips. They want to keep the person on one payslip because it gets too complicated for people.
Yeah.
So that's my question. That's kind of the background.
Yeah,
sorry. Is that around who funds the work? Because there is a section in there in medical job planning. Something to say about this generally is that there are parts of medical job planning that are easily transferable back into non-medical job planning. And so what we did is we slimmed it down a lot and we designed it specifically for non-medical job planning. But there are things like you can tag activities. So say it was a research activity, you could tag it as so you could find all of the activities that are research based, or you could tag all the activities that are in a certain location, for example, or all the activities that were COVID related or something like that. So the tagging allows you to go kind of horizontally across. Obviously, you've got the kind of categorization of DCC and then activity and subcategory. So there's a kind of a tree structure to the activities, but there's also one that allows you to kind of cut across sideways. And there's also like a funding. I can't remember the exact phrase that's on there, but it's like a sort of who's paying for this, which cost center does it sit in? So you can incorporate it there. So, but I'm just wondering, is it two job plans, or would it be one job plan with activities where you need to sort of isolate activity types and separate them?
Thank you. So in my trust, we're going to have both. So we've got block contracts with our commissioners, and then say in our specialized services, we're going to have individual contracts for cost centers, and those individual contracts will differ one from the other. So it gets a little bit complicated when you're trying to. The reason I'm asking these questions is so I'm responsible for preparing my trust PLIX submission each year, patient level costing. So I have to try and unravel the information I get in from different parts of my trust, and sometimes that's difficult. Job planning is an issue. We have got a medical job planning system in place, but to me, it's not very user friendly. So when I need to extract information from it, it's a little bit difficult. Simple example, I have to use data in Excel.
Yeah.
And I have to then match up these categories that you're talking about to the national categories for job plans. So then it'll work in the costing model. So at the moment, I'm having to do that manually via VLOOKUPs and using the matching index functions. And that's quite tiresome. And I'd like to be in a position where that could work quite smoothly without taking up a lot of my time. Just trying to do the kind of the mechanical side of it. So I'm interested in this, and I can see there are many applications for it. But yeah, what I've seen so far is looking really good.
I mean, obviously, I don't know the exact details of the
No.
Excel spreadsheet that you're using, but I would, I think that sounds like something that we could put in using the kind of the tagging and the categorization.
Yeah.
I mean, our job really is looking. For the last 15 years, we've just been finding people using Excel spreadsheets and turn that into software. So it's a continuation of that.
Well, that's how medical job planning came about with Harrogate. That they sent us their Word document. As it was then, it wasn't even a spreadsheet, and it's developed there. But oh yeah, I'd like to add to that. I think when you look at a system like this, I think there's an important question to ask is what can the system do? But I think the more important question is how does the provider of that system operate in terms of continually developing a system? Because I often talk when I talk to people about revalidation to say that, you know, if you gave me your spec from 2012 for revalidation to buy a system in 2020, it wouldn't work. And it's the same with these things. It's about ensuring, and that's something we do, and that's why I mentioned partnership working. It's about ensuring that we continually develop the system. And there are going to be areas or pockets where certain trust requires certain things, but that's literally how we've operated for the last 10 years. Everything you see in front of you on the system now has been developed in partnership. So if there are things that don't seem to be there at the moment, well, that's fine. That's what we want to work in partnership around to make sure that we can build those things in. And just to give you an idea, sort of over the last 10 years, we've only ever charged twice for that sort of development work. But they were really outside of the scope of the projects. So hopefully, Imran, if there's stuff that, as Kevin said, there's stuff we can transfer across from the medical side. But if there's things that would make not just yours, but others in this group life a lot easier, and those are exactly the sort of things that we'd look to sort of push on and develop.
Yeah, that's good. I think what's occurring for me is there's two aspects to it. One is the internal governance, i.e. for the individual putting their job plan together, and the employer, the trust, and that's fine. And that can have lots of categories suited to that particular role or job. And then there's the external stuff that trusts have to do because they're mandated. And one of these things is patient level costing. Now, there are lots of other things that trusts have to do to meet external requirements. So there's like two aspects to this, how you use this data. So I'm really interested in it, but thank you.
Yeah, I think just where on that, it's worth mentioning because we've actually got some webinars coming up which touch on slightly different areas that impact on this. One, we're having a webinar on the 4th of November around something we call Murphin Plus, which is around capacity and demand. So it's taking job planning to another level. And then at a date not yet set, we want to run a webinar about team job planning, because that actually is going to be something that will answer a lot of those questions, Imran, sort of moving forward. So there's something we'll obviously let everyone who's been involved in this know that when they're going to be, but it's worth keeping an eye out for. Were there any other questions? I noticed there's some that I think have been answered about whether it's being recorded or not. I'm just trying to see. One was about forwarding slides. Has anyone got any sort of pressing questions about the system?
We will take just for the recording. We'll take the recording. We'll what's it called? Microsoft Stream. It's difficult to provide access from there from our SARD JV organisation account, so we'll probably upload it to YouTube, and then we'll also put a video on our website, so you'll be able to access it from there.
Yeah, I mean, just for the purposes of this, I mean, Andrew asked a question. Kevin, I don't know if you want to take that because it's around interfacing with ESR. Just for the purpose, because we'll send, people be able to see this, so maybe a question other people will have.
Yeah. So ESR, we've got the ESR wrapper, which was the last webinar that we did. That was the NHS improvement funded project. We basically built an API interface, which is a way of saying, how do computers talk to each other? And we built that for ESR. As far as it being bi-directional, I actually spoke to David Booth, who's the integrations manager, last week, and said basically we've got a very good relationship with the NHS ESR team, and we talked about all the sort of bi-directional links and how available they were. There actually aren't a lot of inbound interfaces into ESR. They simply don't exist, and anyone telling you otherwise is what would be news to David Booth, who's the integrations manager at ESR. There's attendance and absence. There's an occupational health inbound link. There's some email updating, but the inbound functionality, as in data that you can take from your system and put into ESR, is very limited. Having said that, IBM, who are the current contract holders for ESR, are working with them to provide an inbound API interface for ESR. So we're working so closely with them that we'll be on that straight away as and when it comes. So there's information we can grab from ESR. It's a little harder to push it back the other way. That's nothing to do with us. That's just simply those interfaces don't really exist.
And then
you also mentioned, as you mentioned, interface services. Does this include allocate to link with our current roster provider? Yes, I mean, all of our systems got APIs on them. It's really dependent on how willing they are to open up their API access and how much they charge you for that. Our API access, it comes in the purchase price of the product. We don't charge extra for the API interface. I don't think that would be right. Not everyone feels like that. So yes, we're happy to do linking up with other rostering systems. I mean, we've got our own e-rostering system, which we'll have a webinar about, and people seem to like. In fact, we've migrated people away from that system to ours. So that's coming up. But case in point is UCLH, who have got Rotomap for some of their rostering requirements. We're doing some integration work with them at the moment around job planning and rostering. So the idea is that in your roster, you can see your activity summary for your job plan, and you can make sure that the roster is sort of balanced with what's going on in the job plan, and vice versa. So that when you're in your job plan, you can see if your job plan, if you're saying I'm doing X amount of DCC on a Monday, does that reflect actually what was happening last time you were rostered, and does that look like the balance of stuff that you had in your shifts? And so that's for us, we think that's a good starting point to make sure there's basically visibility on both sides of that, so that when you're doing your roster or when you're doing your job plan, you're informed by one or the other. I hope that answers that question.
Cool, thanks, Kevin. Is there any other pressing questions from those who are still with us? I'm giving that nice little time for pause. Okay, well, yeah, I mean, obviously, if there's anything that anyone wishes to ask afterwards, I know Chris is going to be following up with everyone to there's Chris. Say hi. Following, so obviously you can come directly back to Chris or to myself. One of the things, obviously, if you get an opportunity and you want, if you're new to SARD, please feel free to go to our website, sardjv.co.uk, and there's lots of product pages on there.
Phil, did you mention team job planning at all?
I mentioned that we will be running a webinar in the future on it, but we hadn't set a date yet.
Yeah, so obviously it's an important part of the levels of attainment. We're really keen to get that rolled out in trusts to get people up to level 3, and you know, we're a good ally in getting that process up and running.
Yeah, I mean, I think we make sure that we will advertise these webinar dates as we go through. But certainly, there's one you see on here. There's something called Murfin Plus. That will be coming up in November on the 4th. But there's also other information on the website that will be useful. So we have quick introductions. We have information about the levels of attainment. Obviously, you can find out more about us, who we are, what we do, if that's something of interest. But if there are no more questions, I'd firstly like to thank everyone for attending and for listening to me for nigh an hour, which I'm sure is not easy. It's easy for me, but and yeah, as I say, if there's any other questions, we're all available. You know, SARD is about being open and approachable, so our information is accessible. But as I say, Chris will reach out to each of you afterwards just to make sure that we follow up. But beyond that, yeah, thank you very much, everybody, for your time.
Thank you, Phil. Well done, mate.
Thanks very much. Bye.
Cheers. Thanks. Oh, hi, Rashenda.
Yeah.
Hi, and bye.
Thank you.
Right.
See you
Cheers,
soon.
everybody.
Yeah.
Thank you.
Bye.
Bye.
Thank you.
Bye.
I'll stay to the bitter end. There you go. Lovely. Does someone have to stop recording?
I think we'll have to log off. Then
Okay.
I'll stop it. Bye all.
Bye.